A very good evening, everyone, guys. A very good evening to all of you. So, how are you all? I hope you all are doing good. So now, according to the schedule given in this session, we have to actually deal with the abdomen topic, guys. And just give me a minute. I'm going to add the this thing here. Oh wow, wow! Good evening, happy New Year! A very, 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 very happy New Year to all of you guys. I've already sent the message in the group also. I hope you all got my wishes. So thinking on and actually hoping that this year should bring something good for us. Oh, welcome, everyone, guys. Yes. So now the PDF has been uploaded here. Welcome, everyone. Yes, guys. So the very first class of our 2021, I should say. Actually, in the morning, I have taken one class at 7 o'clock in the morning, 7 a.m. exactly in the morning, and that was actually a rapid revision session for NEET PG. And now it is for FMG, guys. Oh, Ritesh Kumar saw it seems. Okay, well done, very good. तो चलिए सर abdomen topic start करते हैं. And for this topic of abdomen, guys, we're actually having like two sessions right now from 4 o'clock to 6 o'clock, I guess, 4 p.m. to 6 p.m. We're having one session, and then from 6:30 to 8:30. So at a stretch, we're having like continuously like 4 hours. And in this 4 hours, we can very comfortably complete the entire abdomen topic, guys. Okay? And chaliye, without wasting any time further, let's begin with the class. Are you all ready? Are you all ready, guys? चलिए सर बढ़िया, that is really nice of you people. तो हम लोग start करते हैं. And now to begin with this topic of abdomen, let me first of all start with one small topic here, sir. Very small thing, which they are asking the questions regarding this one in your FMG exams. FMG exam, these questions are coming, sir. Now the first small topic that we are going to learn in the abdomen is about the regions of abdomen. Remember, my dear friends, our abdomen is totally divided into how many regions? Our abdomen is totally divided into 9 regions. Abdomen is completely divided into how many regions, sir? 9 regions. And it is divided into 9 regions with the help of 4 planes. And out of these 4 planes, remember, there will be 2 vertical planes and there will be 2 horizontal planes, sir. So there will be 2 vertical planes and then there will be 2 horizontal planes. Now, what is the name of the 2 vertical planes? Vertical plane का नाम क्या होता है? Yes, you can clearly see here. This is one plane here, vertical here, and this another plane, vertical here. And those 2 vertical planes are present exactly in the middle of the clavicle. So therefore, they are actually known as mid-clavicular planes, guys. So the 2 vertical planes are referred to as mid-clavicular plane. Mid-clavicular planes. And apart from that, these 2 mid-clavicular planes, we're also having 2 horizontal planes. And out of those 2 horizontal planes, one will be your subcostal plane, sir. Why the name is given like that? Obviously, here you'll be having the costal cartilage, and that plane is just touching the lowermost margin, the lowermost part of the costal cartilage, guys. So that is why the name is given as subcostal, just below the costal margin. And here you'll be having your ilium bone below, है ना? The hip bone will be having 3 parts. The upper expanded part is ilium, and then ischium, then pubis here. Okay, so there will be like ilium bone here, and ilium bone will actually have the tubercle here, and there will be tubercle there, and yes, that is nothing but your intertubercular plane, guys. That is intertubercular plane. So there will be 2 horizontal plane, one subcostal plane, another one is intertubercular plane, guys. Okay, and don't worry about that initial. I will tell you about all the planes there. Even I'll tell you about the transpyloric plane also. थोड़ा सा hold on, okay? First हम लोग ना ये खत्म करते हैं. Yes, Navira Khatun, a very happy new year to you. A very happy new year to you, guys. चलो. Now with the help of these 4 planes, your entire abdomen is divided into how many regions? It is divided into 9 regions. अब हम लोग एक काम करते हैं. As usual, our same old practice. Let us draw our diagram now. Heading लिखो बच्चों. Regions of abdomen. Abdomen is totally divided into how many regions? 9 regions. Imagine this one here to be your xiphoid process, and this will be the costal cartilages of 7th rib, the 8th rib, the 9th rib, and the 10th rib. And then below here you'll be having your ilium bone here, guys. The upper expanded part, that is your ilium. And then, my dear doctors, there will be one vertical plane here, mid-clavicular, and there will be another vertical plane here, that is your mid-clavicular plane. So these 2 vertical planes will be your mid-clavicular planes. Okay. Then there will be 2 horizontal planes. One horizontal plane is just touching the lowermost part of the costal cartilage. That is why it is known as the subcostal plane. It is subcostal plane. And there will be one more horizontal plane touching the tubercles of the ilium. That is why intertubercular plane. Intertubercular plane, guys. Wow. Now, after drawing this diagram, you are able to see completely abdomen there. And abdomen is totally divided into how many regions? 9 regions. How to learn the names of all these 9 regions? It's very simple. First of all, start from here. You'll be having your umbilicals here. That is why this region will be umbilical region. Lovely. Above the umbilical region, this one will be your epigastric region, or we can simply say epigastrium. And below the umbilical region, this is hypogastric region, that is hypogastrium. Okay, so umbilical region, above the epigastric region, and below the hypogastric region. And the students who are writing the exams nowadays, they're always coming back and giving us the feedback. So there were clinical questions given, and the clinical questions they'll be giving like, a 30-year-old male comes to the clinic with a pain in epigastric region. है ना? ऐसे words आते हैं कि नहीं आते हैं? Do you get these kind of words in your exam? Yes, है ना? So when you're learning about when you're actually learning about your this thing, surgery and all those things, a patient comes to the clinic with a pain in the epigastric region, with a pain in the hypogastric region, something like that. So that is the reason why you have to know about the regions of the abdomen, guys. So umbilical, above the umbilical region there will be epigastric region, and below that there will be hypogastric region. Now after that, what is this present here, guys? Here you'll be having the costal cartilages. What is another name of costal cartilage, or simply cartilage? Cartilage का दूसरा नाम होता है chondrus. Another name of the cartilage will be actually chondrus. So that is why this region will be below the chondrus. So this one is your right hypochondrium, and this one will be the left hypochondrium. Hypochondrus or hypochondrium. Chondrus, the word is coming from the cartilage, guys. And after that, no doubt about that, this region will be your lumbar region. And because you're having lumbar region, there'll be a right lumbar and then there'll be a left lumbar region. And this region will be the iliac region, and iliac region will be again the same thing, right iliac and the left iliac region. Kya baat. Simple. So all the 9 regions of the abdomen, how to make the name, I have made it like simple. So first start from the umbilical region, above the epigastrium and below the hypogastric region, and then right and left hypochondrium, right and left lumbar, and right and left iliac region, guys. Are you all comfortable with this one here? Come on guys, are you all comfortable with this one here? Chaliye, badhiya. Now after learning this one, after learning the 9 regions, now welcome here sir. Let us go to the doubt that is asked by Dr. Nishal here. तो सब लोग यहाँ पर ध्यान से देखो. Now in this diagram, let me just zoom this diagram here sir. थोड़ा सा इसको zoom करते हैं. हाँ. In this diagram here you're able to find the transpyloric plane, then the subcostal plane, supracristal plane, and intertubercular plane. And in your MCA exam, they are asking you about their levels. Which plane will be found at which level? They are asking this one, guys. So just you need to memorize which plane at which level. So my dear doctors, transpyloric plane will be at the level of L1. But sir, why the name is given like that? And why should I, or how should I easily learn this one? L1 है करके. So यहाँ पर ध्यान से. For example, you have got your esophagus here, then this one is your stomach here, and the stomach will actually continue to what is duodenum. First part, second part, third part, and fourth part. This is how it will be present. One thing you just remember from now itself, from the beginning of the abdomen topic itself, you remember from now itself, guys. Duodenum will be extending from where to where? Duodenum कहाँ से कहाँ तक होता है? Duodenum will be extending from L1 to L3. Duodenum will extend from L1 to L3, guys. L1 to L3. That is very much important landmark. That will help you a lot. I'm telling you. I repeat again. Duodenum will extend from L1 to L3. अब यार थोड़ा सा ना recall from your MBBS days. What are the parts inside the stomach? Inside the stomach, that upper rounded part is known as fundus. This is known as the in the middle body. And after that, you'll be having the pylorus part of the stomach. I hope you have learned in your MBBS days. Pyloric antrum, pyloric canal will be there. Pylorus part. And that pylorus part of the stomach will continue into first part of duodenum. Pylorus part will continue into first part of duodenum itself. And now you can clearly see that plane is passing through the pylorus part. Transpyloric plane. And of course, sir said that duodenum is going to begin from where? L1 only. So therefore, transpyloric plane, which level? It will be present at which level only? It will be at the level of L1 only, guys. Must are you able to correlate everything there? Why the name is given as transpyloric there? Why? Because it is passing through the pylorus part of the stomach. How can we remember it at L1 only? Why? Because pylorus will continue to duodenum, and duodenum is going to begin from L1 part only. So it should be definitely at which level, sir? L1. Okay. So transpyloric plane will be at the level of L1. Now the next plane is subcostal, touching the lowermost part of the costal cartilage. It is touching the lowermost part of the costal cartilage, and that is subcostal plane. Subcostal plane is at the level of L3. After that, this is your ilium, the iliac bone. And iliac bone, the uppermost part is nothing but the crest, iliac crest. And yes, supracristal. That is why it is touching the iliac crest, supracristal plane, and that is at the level of L4. I challenge all of you people after my class, go back and look at the previous year questions of FMG. Recently only, guys. Recently in the previous year questions of FMG, last year only, they have asked this question. Okay, but they did not ask this question like directly. Very supracristal plane is at which level? करके नहीं पूछा गया था. The way they have asked the question in the exam was iliac crest is at which level? Understanding your point here? The iliac crest is at which level there? Yes, at the level of L4. Then after that, there will be tubercle here, there will be tubercle here. Between the two tubercles, intertubercular plane, that will be at the level of L5. So basically, all of them are the lumbar region. L1, L3, L4, L5, except L2, so nothing at L2. 1, 3, 4, 5, 1, 3, 4, 5. So at L1 it is transpyloric, at L3 it is subcostal plane, and then at L4 it will be supracristal plane, and at L5 it will be the intertubercular plane, guys. I hope Dr. Nishal, your doubt is absolutely clear right now. है ना? तो कहीं ना कहीं आपने transpyloric सुन रखा था, and this is what you have to remember about the transpyloric plane, guys. Okay बच्चों, are you happy? भाई कुछ तो बोलो यार. In every class I have to tell you like please cooperate, answer. ये बैच बड़ा खतरनाक है. You feel like silently listening here, which I don't like actually. समझ में आ गया? Let's go. So we are done with like two small topics here. One is about the regions of the abdomen. Abdomen is totally divided into 9 regions. And the second thing is we have actually learned about the planes here, sir. We have learned about the planes and at what level they are present, sir. Sir, what about the vertical and horizontal planes? अरे यार वो तो मैंने बताया ना आपको. That is helping us in learning about the regions of the abdomen. They are two vertical, the two horizontal. So they are like horizontal plane only, subcostal plane and intertubercular plane. They are helping us to divide the abdomen into 9 regions. Simple. तो वो भी topic हो गया. And now we have learned about some other topics also. चलो अब हम बढ़ते हैं आगे. Let's go ahead. So this was just like a warm up session, guys. I think now you all are in the mood of studying. ठीक है? अब मैं आपको बताता हूँ. Now I'll tell you how to learn the abdomen topics. How to approach the abdomen topics. Did you all learn the thorax topic along with me? In thorax topic, I told you the planning very clearly. What's the planning in thorax topic, sir? First learning the thoracic wall, then entering inside and learning about the two organs there. One is your heart, another one is your lungs. That's about the thorax topic. Now similarly in the abdomen topic also, exactly same planning. Exactly the same planning in abdomen, guys. First we are going to learn about the abdominal wall, anterior abdominal wall, posterior abdominal wall. And then the concepts related with that one, guys. The anterior abdominal wall, you have to learn about, the inguinal canal in that one. Then we have to learn about the inguinal hernia, direct and indirect. Then the rectus sheath. There's so many topics to be learned in the anterior abdominal wall. And then we are going to learn about posterior abdominal wall. And once we are done with the abdominal wall, then we are going to enter inside. Inside we are going to learn about all the visceral organs. Stomach, liver, kidney, then the abdominal aorta, the blood supply, inferior vena cava, blah, 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 blah. Are you understanding your planning here, sir? Exactly. This is what we are going to learn in these 2 hours and the next 2 hours. Today 4 hours, entire abdominal topic will be like done and done and done. Understanding, my dear friends? तो स्टार्ट करेंगे सर. तो ये वार्म अप सेशन हो गया अभी. सो वी आर डन विद द वार्म अप सेशन नाउ. वेरी गुड रितेश, वेरी गुड लक्ष्मी. नाउ लेट्स बिगिन फर्स्ट विद द anterior abdominal wall. Please write down the heading there as anterior abdominal wall. My dear doctors, can anyone tell me in total how many layers do you have in the anterior abdominal wall? You'll be having totally 8 layers in the anterior abdominal wall, sir. How many layers? 8 layers in the anterior abdominal wall. Keep one thing very clear in your mind, my dear friends. If you learn all these 8 layers of the abdominal wall, their names, and that too in order, ठीक है ना. All the 8 layers of the anterior abdominal wall, you have to learn their names, that in order. If you learn that, then only you'll be able to understand the next 1 hour of the class. Whatever I'm going to teach you, like next 1 hour of the class, rectus sheath, inguinal canal, spermatic cord, there's so many things to be learned about the hernia. Everything you will be able to understand only and only if you know all the 8 layers of the anterior abdominal wall. Okay? So please don't take it easy. Don't take it easy here, guys. Learn it properly along with me now. Welcome. Let us go from outside to inside. बाहर से अंदर की तरफ. Every medical student knows the first 2 layers are on the outer side. Outermost layer will be skin, and just below the skin you'll be having superficial fascia. ये तो सबको पता है, sir. Every medical student knows that there will be skin and superficial fascia. Very good, Gandhi. Very good, Paul. I'm really happy. But now update your knowledge. The superficial fascia in the abdominal wall is in turn divided into 2 layers. There will be an outer layer which is going to store fat. So outer will be the fatty layer, and then there will be an inner layer which is not going to store fat, and that will be the fibrous layer. Outer layer is storing fat, and inner layer will not store the fat, sir. It's just a fibrous layer. And these 2 layers have given a special name. The outer fatty layer will be known as the Camper's fascia. The outer fatty layer is known as Camper's fascia, and the inner fibrous layer is known as Scarpa. Very good, Navendu. It is known as the Scarpa fascia. चलिए जी बढ़िया. So every medical student knows skin and superficial fascia. I want you to just update your knowledge here. Superficial fascia is in turn divided into Camper's and Scarpa. After learning these 2 layers, learn the layer number 3, layer number 4, and the layer number 5, guys. And these 3 layers will be your muscle layers. And what is the name of the muscle layers in the anterior abdominal wall? In the anterior abdominal wall, you'll be having 3 muscle layers. One is external oblique, another one is internal oblique, another one is transversus abdominis. There are 3 muscle layers. So number 1, external oblique muscle, and number 2 will be the internal oblique muscle, and number 3 will be the transversus abdominis muscle. Okay, so one will be the external oblique muscle, another one is internal oblique muscle, and another one will be the transversus abdominis muscle, guys. So these 3 muscle layers you have in the anterior abdominal wall. And hello, my dear friends, don't take it easy. I told you we are learning from where to where. We are learning from outside to inside. Okay, now outside to inside. So don't think that as we are writing on the screen here, like a list, it is not like above downwards, sir. ये ऊपर से नीचे नहीं है. ये ऊपर से नीचे नहीं है, ठीक है ना? So it's not from above downwards. It's actually outside to inside. So all these layers are arranged one by one inside here, sir. All these layers are arranged like one by one inside. So there'll be skin, uske under superficial fascia, inside the external oblique, inside the internal oblique, something like that. And you'll understand the importance of that within few minutes. Chili. So after these 3 muscle layers now, welcome to the number 6 one. Again, there'll be a fascia. Transversalis fascia. Or in some books, it is also written as fascia transversalis. Transversalis fascia or fascia transversalis. There's one more fascia. And nowadays your MC examiners are a lot interested in this one. So there are many questions coming on that. And after that, the layer number 7 and layer number 8. How to learn their name, guys? अरे यार ये बताओ, just tell me one thing here. Our heart is covered by pericardium. I don't know whether you will have seen. I've taken one recently, one YouTube session I've taken about the pericardium and sinuses of pericardium. Did you like that one, guys? Did you like that one? देखा होगा आपने YouTube पे मैंने आपको pericardium के बारे में पढ़ाया था, and the sinuses of pericardium, the oblique sinus and the transverse sinus, है ना? That was a beautiful setup there in Bangalore. So I've taken the advantage of that studio and I have taught you in that manner, just to give you like that 3D kind of feeling, like rich content you can say ना, वो आजकल YouTube में कहते हैं ना, like rich content. Yes, something like that we'll do. Don't worry. Acha, the heart is covered by what? Pericardium. Lungs will be covered by what? Pleura. And similarly, the abdominal visceral organs are covered by peritoneum. How many layers are there in peritoneum? 2 layers. The outer one, parietal peritoneum. The inner one is visceral peritoneum. The outer one will be the parietal peritoneum. Inner one will be the visceral peritoneum. Now, when you're going from outside to inside, when you're going from outside towards inside there, now tell me, guys, which peritoneum will you come across first? When you go from outside towards inside, which peritoneum will you come across first? Parietal peritoneum. Now, imagine my hand here to be parietal peritoneum. And just outside this parietal peritoneum, there'll be one more peritoneum here. Sorry, there'll be one more layer here, and that is why that layer is known as extraperitoneal layer. Are you getting me? You imagine my hand to be parietal peritoneum. Just outside that one more layer, and that layer will be nothing but extraperitoneal. So therefore, number 7, extraperitoneal layer, and that is also going to store fat only. And after that, we'll be having the parietal peritoneum. So that's all. These are the 8 layers of the anterior abdominal wall. Are you all perfect with this? Hello, my dear friend. मैंने आपको क्या कहा था? You have to learn the names of all these 8 anterior abdominal wall layers. That do in order. Then only you will understand the remaining topics. वरना remaining topics भूल जाओ सर. मस्त confusion होगा, full confusion होगा. चलिए आगे बढ़ेंगे. Shall we go ahead? So now you have to learn all these 8 layers of the anterior abdominal wall. Otherwise, you will not understand the further topics. Sure. Now, whatever I have told you here in written, let me show you the picture. This is the image of the anterior abdominal wall layers. Now, in this image, what you do here? First of all, you will look on this side here. आप पहले ना यहाँ देखो. Look on this side. On this side, what is the outermost layer? Skin. Just below the skin, superficial fascia. Outer, fatty layer, Camper's fascia. And inner, that thin one without any fat, Scarpa fascia. That's about the skin and superficial fascia. Now, अब आप क्या करोगे? Remove the skin and remove the fascia. Then the diagram will become like on the other side. No skin, no fascia. When you have removed the skin and the fascia, then you're able to see the 3 muscles there. External oblique muscle, internal oblique muscle, and then the transversus abdominis muscle. External oblique, internal oblique, and transversus abdominis muscle. And then again, you'll be able to find a fascia, transversalis fascia. There'll be a thin layer storing fat, extraperitoneal layer, and then there will be a parietal peritoneum, guys. That's covering the organs there. So these are all the 8 layers of the anterior abdominal wall. I hope you all are perfect here. Okay, bachcho? So we are done with the writing work also, and we are done with the image also, guys. Diagram bhi ho gaya, sir. ठीक है जी. Actually, in the abdomen topic, in the starting, in the beginning, all these topics are like very conceptual topics, whatever we are going to learn now. And they're even having some clinical application also. When you learn surgery, in surgery, the most important part will be your GIT wala part. GIT surgery बहुत important है. So for that, this abdomen topic is very much important. And whatever we are learning in the beginning here, extremely important. अब एक काम करो सर, for 2 minutes, completely drop your pen and sit back, relax, and enjoy the show. सर, एक 2 मिनट के लिए आराम से बैठो. I'll tell you the entire concept. Then afterwards, I'll make you write down. सर, ठीक है? Look at this picture here. Same anterior-abdominal wall only, but this muscle, which is coming from the lateral side here, this one, will be your external oblique muscle. Okay, sir. Now this external oblique muscle will come here, and then I'll be having this aponeurosis. This whitish colored one that you're able to see here, that is your aponeurosis. And thank God doctors have given an easy name only. It is also known as external oblique aponeurosis. And from both the side, that will come and meet where only, sir? In the center. And in the center, you have that shallow depression known as linea alba. Very good, Dr. Paul. It will come and meet at linea alba. Okay, Ji, no problem. Now what I'm going to do is, I'm going to cut and remove this muscle. Try to understand it like an animation, sir. So I'm going to cut and remove this external oblique muscle. If I remove this external oblique muscle, inside that I'll be able to see what? Internal oblique muscle. This is external oblique, so I'm just cutting and removing this one here. And yes, I'm able to see internal oblique. And absolutely the same concept again. Again, we'll be having what's the aponeurosis. And that internal oblique aponeurosis will be coming and meeting again at linea alba. Kya baat hai, sir? Awesome. I will cut that and remove that one, sir. If I cut and remove that, again, I'll be able to see what? Transversus abdominis. External oblique, internal oblique, and now this one is transversus abdominis. And again, the same concept there. Wow. It will also have its aponeurosis there. So basically, guys, what I'm trying to put in your mind here is that from the lateral side, there are 3 muscles coming. You're able to see the 3 muscles coming from the lateral side, sir. External oblique, internal oblique, and transversus abdominis. And they are having their own respective aponeurosis. External oblique aponeurosis, internal oblique aponeurosis, and transversus abdominis aponeurosis. And all the 3 aponeurosis in the center here, they are going to form what, guys? They are going to form a sheath in the center, and that sheath is said to be your rectus sheath. क्या कहते हैं इसको? That sheath is known as your rectus sheath. Oh, so today I'm able to understand that rectus sheath will be in the anterior abdominal wall in the center, and that rectus sheath is formed by 3 aponeurosis. Which 3 aponeurosis? External oblique, internal oblique, and transversus abdominis aponeurosis. I repeat again: external oblique, internal oblique, and transversus abdominis aponeurosis, guys. Okay, बच्चों, are you done? अरे भाई साहब कुछ तो बताओ. Are you getting the clarity here? So don't worry about the rectus sheath topic. I'll teach you about the rectus sheath topic within some time. Within few minutes, I'm going to teach you about rectus sheath. But right now, you just keep the concept in your mind. Oh, rectus sheath is formed by the 3 aponeurosis. चलिए, अब आगे बढ़ते हैं. One more concept now. Oh, look at this diagram. The moment you look at this diagram, guys, some of the students will be like panicked. What the hell is this one? ये क्या है सर? Don't get panicked, my dear friend. You already know this one here. ये आपको पता है. Don't get panicked here, Dr. Vipul Shah. Vipul Patel, sorry. Don't get panicked. ये आपको already पता है. Sir, कैसे पता है? Sir, how do I know this one? Well, come here. What is present outermost part? Skin. And just below the skin, superficial fascia. We have removed the skin. We have removed the superficial fascia. मान लो कि हमने skin को निकाल दिया है, और फिर हमने campers और the scarpa fascia को निकाल दिया है. We have removed that one. After that, which layer? Come on. External oblique. After that, internal oblique muscle. After that, transversus abdominis muscle. After that, transversalis fascia. Inside that, extraperitoneal, and inside that will be having the parietal peritoneum. It is nothing but the same anterior abdominal wall only. And yes, we are expert in that one. Just now we have learned about anterior abdominal wall. Are you getting, Dr. Patel? समझ में आ रहा है कि नहीं आ रहा है? Very good. Okay. So looking at this diagram, don't get panicked. It is the same anterior abdominal wall. Internal oblique is below the ribs. मैं नहीं समझा. I did not get that one. So what? It will be actually having the origin from here. It will be originating from there. But right now we are not taking the section there. हम लोग इस level पर हम लोग वो section नहीं ले रहे हैं. We are almost taking the section at this level. I'm cutting my anterior abdominal wall. Okay, at that level. Very good. After cutting transversely, we are seeing from above. हम लोग ना ऊपर से देख रहे हैं. But it's really good, Ritesh. You know, you have to understand the orientation. मैं आपको इसीलिए तो मेहनत कर रहा हूँ इतना सारा. वरना actually क्या होता है ना, in every anatomy class, I know very well. Even I have also studied during my first year MBBS. Anatomy faculties will directly come to the class. चलो, heading लिखो inguinal canal. Inguinal canal. And in the inguinal canal, we are writing the boundaries of inguinal canal: anterior, posterior, superior, inferior. And that time I was like literally worried. कि साला ये external oblique क्या है, internal oblique क्या है? Understand your point here? We don't know that one. That's the problem. And that is what hard work I'm doing from last 10 minutes here. Okay. First, you need to learn the anterior abdominal wall, their names, and all of those layers in proper sequence you have to know. And once you know that in proper sequence, sir, teacher doesn't have to do any hard work, and neither the student has to do the hard work, sir. बड़ा आसान हो जाएगा. ठीक है मेरे प्यारे बच्चों? Are you understanding? Thank you, the happy brain. ऐसे चलो. So from today onwards, the moment we look at this diagram here, no need to panic at all. Okay जी? अब सुनो थोड़ा ध्यान से. Okay, sir. One more minute. After that, I'll start making you people write down. अभी कुछ नहीं लिखने का. Drop your pen, sit back, relax, enjoy the show. और अब मैं आपको बताऊंगा the crucial points here, sir. I'll tell you 3 points, and those 3 points are extremely important. Full concentration here, sir. 200% concentration here, and listen to that 3 points very, very carefully, guys. Point number 1. There's a layer number 6 here, and that layer number 6 here will be your transversalis fascia. Okay, there'll be layer number 6 known as transversalis fascia. In that layer, you're having a oval-shaped opening. That oval-shaped opening will be referred to as deep inguinal ring. Wow. After my class, go back and check the previous year questions, sir. 2019 MC exam question. In 2019 only this question has been asked, guys. Understanding? I think now it is not like previous year, last before 1 year. Today it is the first day of 2021. You know? So it was asked not like last year, before last year. So 2019 MCI exam question, I'm telling you. Yes. deep inguinal ring is present in which layer? Answer, transversalis fascia. Lovely. Similarly, you'll have a triangle shaped opening here, and that triangle shaped opening will be referred to as your superficial inguinal ring. Where do you have the superficial inguinal ring, sir? It is found in which layer? I can clearly see it is found in the external oblique aponeurosis. Second point to learn. Aram se, sir. Nothing to panic, nothing to rush. Aram se padhte hain. I'll ask you once more, I'll tell you once more, learn once more here. Oval shaped deep inguinal ring. The oval shaped deep inguinal ring will be present in transversalis fascia, and there'll be a triangle shaped superficial inguinal ring, and the triangle shaped superficial inguinal ring is present in external oblique muscles. External oblique. Then what do you have? Like, what are the two layers present in the middle? Of course, internal oblique inside that, and the transversus abdominis inside that. क्या किया जाए? What to do? Observe here carefully, sir. इन दोनों को जोड़ दो. Join them together. Now, don't think that Dr. Azam is joining here. I'm not joining here. Look at the diagram here. Internal oblique muscle and its aponeurosis here. And this one is the transversus abdominis muscle, and you can see the aponeurosis here, sir. Oh my god, oh my god, oh my god. These two are joining together to form conjoined tendon, which is also known as falx inguinalis. And already this question has been asked in the exam. Conjoined tendon or falx inguinalis is made up of dash and dash. Internal oblique plus transversus abdominis. समझ में आ रहा है बच्चों? So deep inguinal ring and the superficial inguinal ring, और फिर जो बीच में जो दोनों layers होंगे ना, in the middle whatever two layers are there, join them together. So उनको जोड़ दो. Class, you're done, done, done. समझ में आ रहा है? Are you getting me? And after that, welcome to the climax of the story. And the climax will be always important, my dear friends. Yes. Join the deep inguinal ring with the superficial inguinal ring. Join the deep inguinal ring with the superficial inguinal ring. And together they are going to form a canal. And that canal is referred to as your inguinal canal. The climax of the story. Are you all understanding here? So join the deep inguinal ring with the superficial inguinal ring. Together they're going to form a canal. And that canal is actually your inguinal canal. Must concept, hai na? Beautiful concept. Chaliye, sir. Now please pick up your pen, paper, color pen, pencil, everything. Start writing, sir. Heading लिखो inguinal canal. Extremely important topic. Yes. Put there as many star marks as possible. Underline that. Highlight that. मतलब जो करना है कर डालो. मतलब उसको घिस डालो सर. बहुत important topic है. Point number 1. It extends from deep inguinal ring to superficial inguinal ring. Okay. Can anyone tell me the location of inguinal canal? Where is inguinal canal located? Above and medial to inguinal ligament. ठीक है बच्चों? It is above and medial to inguinal ligament. Sir, इसका मतलब क्या हुआ? What is the meaning of this one? Above and medial to inguinal ligament. To understand that, what you people have to do is look at this diagram. In this diagram, your favorite anterior, superior iliac spine and pubic tubercle here. We have learned in our last topic, that is lower limb topic. Between them, there will be a ligament here, sir. And that ligament between the AS, IS and pubic tubercle, anterior, superior iliac spine and the pubic tubercle, that ligament will be actually the inguinal ligament. Look just above the inguinal ligament, sir. There will be an oval shaped opening here, deep inguinal ring, and there will be a triangle shaped opening here, superficial inguinal ring. Join them together, join them together. Inguinal canal. अब बताओ बच्चों, tell me in English, where is inguinal canal? Inguinal canal कहाँ है? Above and medial, sir. It's above and medial to the inguinal ligament. It's above and medial to the inguinal ligament. The two words are extremely important for your exam. Achha, not only the location, the next thing is length. Can anyone tell me what is the length of inguinal canal? It is approximately 4 centimeters. But to be very specific in your exams, 3.8 centimeters it seems. And in the PG exams, तो हद हो गया है, too much. 3.75 centimeters it seems. अरे 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 मतलब जिंदगी में कोई दूसरा काम ही नहीं है ना. एक वर्नियर कैलिपर्स, वर्नियर कैलिपर्स याद है तुमको? फिजिक्स में पढ़ा करते थे. ऐसा पढ़ा गया ना ऐसे. 3.8, 3.75. अरे पहले तो इंग्वाइनल रीजन वहां पे, जस्ट इमेजिन दैट 4 सेंटीमीटर्स मैन, कम ऑन, इतना सा होता है 4 सेंटीमीटर ऑन दैट स्केल. 4 सेंटीमीटर इतना सा होता है, उसके ऊपर लड़ाई. लुक एट आवर स्टैंडर्ड ऑफ आवर इंडियन एग्जाम्स, टू मच है भाई. अरे यार, व्हाट्स हैपनिंग इन दैट 2 मिलीमीटर्स, 4 सेंटीमीटर, 3.8, 3.75 सेंटीमीटर्स. हम भी पढ़ा लेते नहीं. हाँ, so inguinal canal, remember the 3 introduction points. It is between deep inguinal ring to superficial inguinal ring. It is above and medial to inguinal ligament, and then it is 4 centimeters just above the inguinal ligament. So किसका मतलब चाहिए तुमको? ये लो भाई, 2021 में शुरू हो गए बंदे फिर से. बंदा देखो लिख रहा है साइज मैटर सर. भाई यहाँ पर साइज नहीं है, लेंथ है. अभी कोई लैंग्वेज में बोले ना कुछ. अच्छा अच्छा अच्छा, अरे दैट इज माय रीजनल लैंग्वेज हियर भाई. तेलुगु, मैंने तेलुगु में कहा था. నేను తెలుగులో చెప్పినది మీకు అర్థం కాకపోతే నేనేం చేయలేం. ఇక్కడ చూడండి, यहाँ देखो. So inguinal canal, you have to just remember the introduction point. अब इसके बाद after this you have to learn the two important things. What are the boundaries and what are the contents? What are the boundaries and contents of inguinal canals? Write the heading first as boundaries, and I'm going to make it damn easy. There is a layer in which you'll be having oval shaped deep inguinal ring. Can you please tell me which layer? बोलो भाई, अगर आप नहीं बोलोगे you will not get that confidence any time. Masu, oh Masu, what posterior Masu? This is my pen and that is you, and I'll murder you. Deep inguinal ring is present in transversalis fascia. Transversalis fascia. Okay. After that, there is one more layer, and in that layer, you'll be having a triangle-shaped superficial inguinal ring. Triangle-shaped superficial inguinal ring. And what is that layer here, sir? That is nothing but your external oblique. Very good, Dr. Priya. Very nice. Excellent. I'm really happy. Okay. Join the deep inguinal ring with the superficial inguinal ring. Join the deep inguinal ring with the superficial inguinal ring, and that becomes your canal. Inguinal canal. अब इन दोनों के दरमियान में क्या होता है? What is there in the middle here? इसके बीच में क्या होता है? मध्य लोहे मुंडन दिकड़ा. Internal oblique muscle. Not only internal oblique muscle, inside that will be having transversus abdominis muscle. And these two muscles, what is going to happen here? Their aponeurosis will go like this and on the other side. Transverse abdominis aponeurosis will also go from above, and then both of them will join together on the other side. And they will join together on the other side to form what only? What only? That is conjoint tendon. And remember, conjoint tendon is also known as what is fox inguinalis. Am I telling this like correct pronunciation? Hello, my dear friends. Am I like telling the correct? My pronunciation, is it correct? Like you people are all like foreign medical graduates, NRIs and all. You have studied in the foreign countries and all. You might be knowing it more better than me, huh? No, I have seen some student calling it like phalanx inguinalis. Is it like phalanx or fox inguinalis? Yes, it's actually fox inguinalis. आप जो बोलो, अब यहाँ पर सर ना आप बोलो ना मैं बोलो, पढ़ो. ठीक है ना, याद रखना इंपॉर्टेंट है. Either you say fox or phalanx. Remember, it is made up of internal oblique plus transversus abdominis aponeurosis. ठीक है. Okay, whatever that big complicated diagram I've shown you, we have drawn the diagram here. हमने यहाँ पर diagram draw कर दिया है सर. ओके ना. पता नहीं मुझे आज ना चेन्नई वाली की बहुत याद आ रही है, क्योंकि न्यू ईयर में ना बहुत सारी यादें जुड़ी है. मरीना बीच तो होता है कभी वैसा. हाँ जी, वेलकम यू. Now what is the topic that we are learning? We are learning about the boundaries of inguinal canal. Inguinal canal के ना हम लोग boundaries पढ़ रहे हैं. तो now what you do out of that big diagram, out of that big complicated diagram, try to focus only and only on the inguinal canal. मुझे इसका boundary चाहिए. Only the inguinal canal, and I want the boundaries of that. Okay. And now, my dear friends, okay. नमस्ते नमस्ते भाविक जन. मसूर टेलिंग नाम बता दीजिए, चेन्नई से ढूंढ के लाया जाएगा. अरे एक्चुअली ना उसका पूरा स्टोरी स्टार्ट हुआ था नाम से. अरे मेरे बाल कहाँ कहाँ जा रहे हैं आज. हाँ, उसका पूरा एक्चुअली स्टोरी ना मसू, उसका स्टोरी स्टार्ट हुआ था नाम से. द एंटायर स्टोरी स्टार्टेड विद द नेम ओनली. हाँ, उसका नाम ना मून था, मून. अरे यार ये ना अनअकैडमी पे सारा ये ना ये वो हो रहा है, क्या बोलते हैं, रिकॉर्ड हो रहा है. रहने दो ना, मैं बाद में बताऊंगा. इसी ग्लास में पानी, ये नैन साफी है ग्लास के साथ. अरे इसी ग्लास में पानी, ये ना इंसाफी है ग्लास के साथ. अरे रे गांधी, अगर आपको ना अनुभव है, अगर आपको थोड़ा सा अनुभव एक्सपीरियंस है, तो कुछ ऐसा भी होता है जो ऐसे ट्रांसपेरेंट लगता भी है. हमेशा वो गोल्डन येलो कलर ऐसा वाला ही ड्रिंक रहना जरूरी नहीं है. थोड़े ऐसे भी होते हैं जो, समझ रहे हो मेरी भावनाओं को. हाँ हाँ हाँ. अरे कभी जिंदगी में वोडका नहीं पिया है क्या? ट्रांसपेरेंट वाला भी आता है, वोडका भी होता है भाई. हैप्पी ब्रेन सर एटलीस्ट कोला तो डालो भाई. नहीं ना, हम नीट वाले लोग हैं. अरे मजाक कर रहा हूँ साहब. ये पानी है भाई, पानी. ये पानी है. दिस इज वाटर. H2O. ओके. पता चला कल तुम लोग मॉर्निंग में फेसबुक पे डाल रहे हो यहाँ पर अनअकैडमी वाले फैकल्टीज पी के पढ़ा रहे हैं. प्लीज डोंट डू दैट. ओके. हाँ. सो दिस वन इज इंग्वानल कैनाल. अब बताओ मेरे प्यारे प्यारे बच्चों, नाउ माय डियर फ्रेंड्स, कैन यू प्लीज टेल मी दिस इज व्हिच बाउंड्री? अब यहाँ पर आपका रियल टेस्ट है. नाउ दिस लाइक रियल टेस्ट. इज इट लाइक एंटीरियर, पोस्टीरियर और सुपीरियर और इंफीरियर बाउंड्रीज? व्हिच बाउंड्री? This one will be the anterior boundary. I'm really happy with all of you. All of you are telling the correct answer. This is the anterior boundary. And now some of the students in first year MBBS, they'll be like confused. Sir, how come it is anterior? ये तो नीचे है ना sir. This is like below na sir. This is inferior na sir. No. External oblique, internal oblique. Those two layers, are they present below in the abdominal wall? No. They're actually present in the front. तभी तो, that is why Azam sir said you in the very beginning of the topic, learn that layers properly. Learn the layers properly. अगर ये inguinal canal है, तो external oblique and internal oblique are present in front of the inguinal canal, not below the inguinal canal. They're not inferior, they're anterior. Are you understanding here? एनाटॉमी में गलती नहीं होनी चाहिए भाई. हाँ, एनी टाइम 24 आवर्स कवर पेज टू कवर पेज विद वोडका विदाउट वोडका. इट्स एंटीरियर मींस एंटीरियर, इट्स नॉट इंफीरियर बाउंड्री. ये नीचे नहीं है, ये आगे सामने. एंड आफ्टर दैट दिस विल बी एक्चुअली द पोस्टीरियर बाउंड्री. चलो बोलो बच्चों, व्हाट इज फॉर्मिंग द एंटीरियर बाउंड्री ऑफ द इंग्वानल कैनाल? एक्सटर्नल ऑब्लिक कॉमा इंटरनल ऑब्लिक. व्हाट इज फॉर्मिंग द पोस्टीरियर बाउंड्री ऑफ द इंग्वानल कैनाल? द पोस्टीरियर बाउंड्री इज फॉर्म्ड बाय ट्रांसवर्सालिस fascia कॉमा कंजॉइंट टेंडन. ट्रांसवर्सालिस fascia कॉमा कंजॉइंट टेंडन. परफेक्ट. ठीक है. अब एक काम करो सर, एवरीवन डू वन थिंग हियर. एवरीवन, आई रिक्वेस्ट ऑल ऑफ यू टू प्लीज स्टॉप राइटिंग. Everyone here, please stop writing here, guys. This is inguinal canal, and this is like in front of the inguinal canal. In front of inguinal canal, external oblique, number one, and number two, this one is internal oblique. External oblique and internal oblique. Okay. This is anterior inguinal canal. What is posterior inguinal canal? Posteriorly, there will be transversalis fascia, and not only transversalis fascia, even the conjoint tendon. These two are present behind the inguinal canal. Inguinal canal के पीछे, आगे और पीछे हो गया सर. Done. Okay. And after that, once you're done with anterior and posterior, now we'll come to guys superior and the inferior. Sir. Now, what do you have above the inguinal canal? Above the inguinal canal is very easy. I can clearly see internal oblique and the transversus aponeurosis are arching above the inguinal canal. Superiorly, इंटरनल ऑब्लिक एंड ट्रांसवर्सस एब्डोमिनस। इंफीरियरली तो सबसे आसान है सर, इंग्वाइनल कैनाल के नीचे क्या होता है? इंग्वाइनल लिगामेंट होता है। What you have below the inguinal canal will be having inguinal ligament. Okay, बच्चों, are well done? In this diagram, just now I told you, this is canal. Below the canal, there will be ligament here. That's all. We are done with the boundaries. Now, after teaching you this much till here, now I want to ask you people. You people, tell me, guys, very frankly, very genuinely, can you learn the boundaries of this inguinal canal without knowing the anterior abdominal wall layers? बिना anterior abdominal wall पढ़े क्या आप ये सारे boundaries पढ़ सकते हो? No, sir. You cannot learn that. Are you understanding here? And that too not only anterior abdominal wall, their layers, and that too in order. And that is the most common mistake made by many students, and not only students, many faculties. No one will actually teach you the anterior abdominal wall and the layers and element directly in one can answer. Sure, start. And our innocent students, they'll be like for 5 minutes they'll try to concentrate. अच्छा external oblique, अच्छा internal oblique. 5 मिनट के बाद में उसके बाद में सारे माइंड में ना सेंसर्ड वाले वर्ड स्टार्ट होते हैं, डैश बी 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 वाले वर्ड स्टार्ट होते हैं माइंड में। छोड़ो यार, एनाटॉमी बड़ा खतरनाक है, नहीं हो पाएगा। समझ रहे? तो प्लीज डोंट टेक द एनाटॉमी इज डिफिकल्ट, देयर इज अ मेथड हाउ टू लर्न दैट, ओके ना? तो ऐसे सेंसर्ड वाले वर्ड्स ना मेरे लिए इस्तेमाल मत करो। यस डॉक्टर डोनाल्ड, यस इंफीरियर बाउंड्री इज नथिंग बट द फ्लोर ऑफ दैट वन। इंग्वाइनल कैनाल सराउंडेड होता है, इंफीरियर बाउंड्री नथिंग बट द फ्लोर ऑफ दैट वन, इट इज वन सेम थिंग। सर प्लीज शो द सुपीरियर वाला इमेज। सुपीरियर वाला इमेज यहां पर देखो, आपको यहां पर बताता हूं। आई शो यू हियर। नाउ इन दिस इमेज कैन यू सी हियर डॉक्टर हैप्पी ब्रेन, ये वाला देख रहे हो इंग्वाइनल कैनाल, एंड इन दिस इंग्वाइनल कैनाल कैन यू सी हियर इंटरनल ऑब्लिक एंड ट्रांसवर्स एब्डोमिनस, इट्स गोइंग अबव हियर लाइक दिस, इट्स आर्चिंग अबव हियर। सो व्हाट डू यू हैव अबव द कैनाल? कैनाल के ऊपर क्या है? इंटरनल ऑब्लिक एंड ट्रांसवर्स एब्डोमिनस। चलो सर, एनी मोर डाउट्स? आई एम रेडी टू क्लैरिफाई योर डाउट्स टू एनी एक्सटेंट। इसी बात पे एक हो जाए। चलिए जी आगे बढ़ते हैं। So now we are done with all the boundaries, sir. Boundaries are crystal clear. Now after learning all these boundaries crystal clearly, now welcome to the contents, guys. What will be the contents of inguinal canal? Do you have inguinal canal in male? Yes. Do you have the inguinal canal in females? Yes. In males, what do you have, guys, in the inguinal canal? Spermatic cord. And along with the spermatic cord, there will be a nerve, ilioinguinal nerve. क्या बात है? In females, what do you have? In females, you'll be having the same nerve, लेकिन nerve से पहले हम लोग लिखेंगे यहाँ पर round ligament of uterus, and along with the round ligament of uterus, what else do you have, guys? The same nerve, so that is your ilioinguinal nerve. क्या बात है? Are you understanding, sir? So that is about the content of inguinal canal in male and the female. So in the male, spermatic cord along with the ilioinguinal nerve, and the female, a round ligament of the uterus along with the ilioinguinal nerve, sir. चलिए, now let me show you this in the diagram here, sir. Look at this diagram. This diagram is actually in the female. तो female में देखते हैं क्या होता है? Are you able to see the uterus here? Same yes. बोलो हाँ, बोलो बच्चों हाँ। In the female here, yes, you are able to see the uterus here, and I think you have learned in your obs gynae class. आपने पढ़ा होगा in OBG, obs gynae, there are so many supports to uterus. Broad ligament, round ligament, blah 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 blah. बहुत सारे supports होते हैं uterus को. Out of that, all the supports to the uterus, yes, one of that will be round ligament, and around the ligament of the uterus is passing, going here, and then it's going to take a turn and enter into the inguinal canal, and then that round ligament will come out of the inguinal canal and it will go and merge with the labia majora in the females, guys. The round ligament of the uterus will go and merge with the labia majora in the female. So yes, it is a content, guys. So what is the content of inguinal canal in the females? What is the content of the inguinal canal in the females? Yes, round ligament of the uterus, and then there is a nerve, and nerve के लिए तो आपको सिर्फ नाम याद करना होगा, and that nerve will be ilioinguinal nerve, and I'll tell you later on that nerve will be coming from your lumbar plexus. So मेरे सर, रोहित कुमार is trying to tell us something. RBCU uterus support मतलब क्या होता है? रोहित कुमार is like a mnemonic. रोहित कहाँ हो? चलो male. Now in the males again the same thing, sir. There will be a ilioinguinal nerve, sir. There will be a nerve known as ilioinguinal nerve. Nerve same है. अब पंगा ये है कि sir, what is the spermatic cord? Okay, and again the same problem here, sir. Many students, what they're doing is spermatic cord, they're writing like a list, and then mnemonic ABCD and all those things, they're mugging. No need to mug up in my class. Welcome to my anatomy class. अब मैं आपको बताऊंगा what is spermatic cord. बच्चों ये बताओ, tell me one thing here. In males, during development, testis will be formed where? मतलब testis पहले कहाँ form होता है? Round ligament, broad ligament, and uterosacral ligament. अच्छा. Okay, Rohit, thank you. Cardinal ligament. Okay, Rohit. Thank you, Rohit. Thank you, no problem. One day I'll take a class, or I'll do one thing. One day I'll even teach obs gynae also. किसी ना किसी दिन मैं obs gynae पढ़ाऊंगा. बड़ा खतरनाक पढ़ाता हूँ मैं obs gynae. Full non-veg, and that will be exclusively for boys. My boys, only my boys. You teach bio full class, sir. Bio मतलब biochemistry, or you're telling biology? अनअकैडमी पे ना ये बड़ा खतरनाक है यार. Who is coming? Who is studying? मेरे को सबसे बड़ा टेंशन तो like you know the full tension will be in special class, free class. In that special class, even 11th and 12th standard students are also coming. Even the students who are not even like MBBS students, they're also coming and joining there. अरे बाप रे. तो ये bio का मतलब biochemistry है कि biology है? Biochemistry. No problem, रोहित कुमार. Biochemistry class will schedule. ठीक है? अरे ओके रोहित. अरे मैं दूसरों के बारे में कह रहा हूँ, डोंट टेक पर्सनली. हाँ हम लोग जनवरी में करेंगे ना, जनवरी आने वाला है नेक्स्ट मंथ, हम लोग जनवरी में करेंगे. चलो सर. Now what is the spermatic cord? I want to learn in a conceptual manner. I don't want to mug up like what is like all the contents of spermatic cord. Now tell me, in males during development what is happening, guys? Testis is forming in the abdomen. Yes, everyone has written there. Testis will be forming in the abdomen. But during development what is going to happen here? Okay. अरे बाप रे, ये फिर से confusion start हो गया. See, Dr. Ranjana, and the moment Dr. Ranjana is asking the question, Amir Sheikh also came. Sir, this class is same for FMG and NEET PG student. अरे बाप रे. I will clarify this once for and ever. Hello, my dear friend. Inguinal canal will be same whether it is FMG or whether it is NEET PG or whether it is like USMLE or PLAB, whatever it might be. Inguinal canal is going to remain the same. I'm telling you. Now, Dr. Ranjana and Amir Sheikh. Now the difference will be, it is something like this. Look at me here. ऐसे यहाँ पे देखो. Suppose this is the complete topic of inguinal canal, right from scratch to the highest thing, inguinal canal. So we will be teaching from the scratch till here for FMG. यहाँ तक तो सेम होगा, inguinal canal सेम होगा. Suddenly the NEET PG length will not change. Suddenly in the NEET PG location will not change. Okay ना? वो above inguinal ligament से below inguinal ligament तो नहीं आएगा. So this topic will be always the same. You'll be thinking like Azam sir is teaching same only. But when you attend the NEET PG class, then what is going to happen is something will be additional there. Almost like 20 to 30% of syllabus will be additional there, and that will be added in the middle. Are you understanding your point here? Are you getting a point here? That is the difference. Okay, I will just give you one example here, guys, so that now you people are not going to ask me this question like again and again. For example, right now for FMG student, I told that these are the content. Okay, now when it comes to NEET exam, in the NEET exam, when you're preparing the students for NEET PG and INS set also, out of these contents, will be asking like which is a true content and which is a false content. Additional 10-20%. So, are you getting Ranjana? Spermatic cord is a true content. Ileoinguinal nerve is a false content. In the female round ligament is actually a true content, whereas this ileoinguinal nerve is a false content. Now, sir, what is this true content and false content? इसका मतलब क्या होता है? सुनो यहाँ पर ध्यान से. Deep inguinal ring, oval shape, and then the superficial inguinal ring will be actually the triangle shape here, like this something. Any content which is entering from the deep inguinal ring and coming out from the superficial inguinal ring here, that will be a true content. Any content which is entering from the deep inguinal ring, coming out from the superficial inguinal ring, true content. And any content which is piercing from the posterior wall, entering inside and then coming out from here, that will be a false content. So the nerve, the ileoinguinal nerve, is piercing from the posterior wall of the inguinal canal and then coming inside and is a false content. Now this information, we'll never say this information to the FMG students. If you said this information to the FMG students, first of all, it is not required. Unnecessarily, why to burden? First thing. And second thing, most of the students in FMG, they'll be getting worried about this once they be true, false, क्या है. तो बड़े प्यार से, आराम से, slowly पढ़ाना पड़ता है. Did you understand the difference here? So when I'm going to teach for the NEET PG students also, I'm going to start from the scratch. The topic will be the same, and then we are going to add the additional things there, whatever required, wherever required. हम लोग को add करते जाएंगे. I hope now you got the difference very clearly. और ये अगर सारी चीजें हम लोग ने FMG वाले स्टूडेंट्स को पढ़ाएंगे ना, वो बड़े इनोसेंट होते हैं, बोले लोग होते हैं, बहुत मेहनत करके आते हैं बाहर से, हाँ, फॉरेन कंट्री में बहुत मेहनत करना पड़ता है. I know very well they'll be like very hard working in the foreign country, and after 5-6 years they'll be coming here. So we need to teach them very, बड़े आराम से, बड़े प्यार से, क्योंकि बहुत it will be very cold outside, temperatures will be very less, they have to maintain heat always, they have to wash their own clothes and cook for their own food. I have seen their lives very closely. तो I know अलग से फ्लैट लेके, मतलब बहुत मुश्किल रहती है. भाई मैंने ऐसा कुछ नहीं कहा, ठीक है ना. ऑल द अदर पीपल यही है बाद में. रितेश को पकड़ लेना क्लास के बाद में. ये मैंने ऐसा कुछ नहीं कहा सर. रितेश ने कहा ये पढ़ाई के अलावा सब कुछ हो जाता है. मेरा से कोई इंटेंशन नहीं था. आई वाज लाइक शोइंग माय एम्पैथी और सिंपैथी, क्या बोलते हैं इंग्लिश में, बस. चलो. So that is about the content, guys. अब सुनो. We have now understood the content in the female. In female, inguinal canal will have two contents. Yes, number one, round ligament of the uterus. Number two, ilioinguinal nerve. Number one, round ligament of the uterus. Number two, ilioinguinal nerve. And then in the males, number one, spermatic cord, and number two will be ilioinguinal nerve, guys. So ilioinguinal nerve, no problem. Now let us learn about the spermatic cord. And I want my students not to muck up this one, guys. Learn it conceptually. अब concept सुनो ध्यान से. Now the concept here is that in males during development what will happen? Testes will be formed in the abdomen, guys. Testes कहाँ पर form होता है? During development abdomen form होता है. Now during development what is going to happen? That testis will actually descend down and go into the scrotal sac or the scrotum. Testis कहाँ पर जाते हैं? Scrotal sac या scrotum में जाता है. Why? Now as a simple medical student, first year MBBS student, I'm getting a doubt in my mind. Okay, sir, why? Why is it going to the scrotum? Why? Because in the scrotal sac temperature is 2 degrees less than that of the body temperature. In the scrotal sac the temperature is 2 degrees less than that of the body temperature. And because the temperature is less there, that is actually required for what? Spermatogenesis, the formation of spermatozoa, guys. Spermatogenesis. उसके लिए चाहिए. That is why the testis has to descend down. अब मैं ना एक बारी क्लास ले रहा था दिल्ली में. I was taking a class in Delhi. You already know Delhi people, Delhi students, वहाँ का माहौल कैसा होता है, environment, and that to live class. Almost like somewhere around 500 plus students were sitting in the class. It was a huge big hall. Almost 500 students sitting there. And I asked the question. Suddenly, मैं भी बड़ी मस्ती में रहता हूँ. मतलब I cannot take the class very seriously. मैं seriously class नहीं ले सकता हूँ. तो बच्चों से ज़्यादा क्लास में मैं मस्ती करता रहता हूँ. More than students, I'll be enjoying the class. Some of the students will not be liking that one. But अब क्या करें यार, आदत से मजबूर है इंसान. फितरत में, आदत में नहीं, फितरत में. So इंसान की आप आदत बदल सकते हो, फितरत नहीं बदल सकते हो. ये मैंने क्या बोल दिया. तो in Delhi class, I just asked the students के in males the testis is descending down, well and good, and we also understood the reason also. Temperature 2 degrees less required for spermatogenesis, बहुत ही जरूरी. Now I asked, it should be similar in females, right? Development, it should be similar in females. तो मैंने ऐसे क्लास में पूछ लिया, what is similar to testis in females? In females, male gonads are actually testis. In females, it will be ovaries. है ना? तो in females, it will be ovaries. My question was, why will ovaries not descend down? कभी सोचा है आपने? Out of the box. Have you ever thought? Come on, any idea? Suddenly a thought came in my mind, okay, sir, males में ना testis descend होती है. In females, why not ovaries descend down? And that day, almost for 20-25 minutes, it was like completely uncontrollable class. Everyone was laughing. Everyone was laughing in the class. Look at the explanation there. Look at the answer there in the chat box here also. अब यहाँ तो ये ऑनलाइन क्लास वेरी फ्यू स्टूडेंट्स आर देयर. जस्ट इमेजिन 500 स्टूडेंट्स, 500 डिफरेंट माइंडसेट, 500 डिफरेंट आंसर्स, व्हाई द ओवरीज विल नॉट डिसेंड डाउन. और उसमें से ना हमारे एक यूपी वाले भैया, लखनऊ, अरे भाई लखनऊ नवाबों वाला शहर, मस्ती में रहते हैं लोग, मस्त में. आउट ऑफ दैट 500 स्टूडेंट्स सिटिंग देयर, वन यूपी फेलो वाज सिटिंग एट लास्ट देयर. वो भाई साहब ने हाथ उठाते हैं, सर I know the reason why. I was like, oh my god. बता भाई बता, तू ही बता. He was like, sir, the ovaries will not descend down in females because of cosmetic reasons. अच्छा भाई क्या बात है, भाई को बहुत अनुभव है. 5-6 साल रशिया में, बिकॉज ऑफ कॉस्मेटिक रीजंस, कुछ भी. अरे रे 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 रे. तो I'm telling you ना, I'm really missing that thing. वो जो लाइव क्लासेस वाला जो मजा आता था ना, ओए होए, वो बात ही लगे. चलो सर, अब हम बढ़ते हैं आगे. Let's go ahead. So hello my dear friends, what I'm trying to tell you is that in males what is going to happen, the testes will be formed in the abdomen, and after forming the abdomen the testes will actually descend down to the scrotal sac. अब ये descend होता कहाँ से है? The descent will occur from here. And come now, it is descending down. Now if the testis is descending down, I think everything connecting to the testis has to pass from here only. Everything that is connecting to the testis should pass from here only. अरे हाँ या ना? Artery, yes. The vein, yes. The nerve, yes. And not only that, my dear friend, testis is actually going to produce the spermatozoa. And that spermatozoa has to come out, and they are going to come out via a duct. And what is the name of the duct? The name of the duct is vasa deferens. What does that mean, sir? Vasa deferens or ductus deferens. Vasa deferens or ductus deferens. And even that is also going to pass from here. So therefore, my dear friends, number 1, artery; number 2, the vein; and number 3, the nerve; and number 4, the duct. All of them are going to pass from here only, and together they are going to form a cord, and that cord itself is known as the spermatic cord. Wow! If you people don't believe me, let me just zoom this and show you, so that you will trust me that Azam sir is teaching correctly. Yes. Look at this one here, sir. Are you able to see the reticular artery here? Yes. Are you able to see the vein here? Yes. Are you able to see the yellow colored nerve here? Of course. And then there's a duct. All of them together surrounded by the 3 fascia. And together it is known as the spermatic cord. इसको spermatic cord कहा जाता है. ठीक है ना? हमें शेख इज टेलिंग एम बी बात करते थे सर, लेकिन रिकॉर्ड हो रहा है ना, इसलिए हाँ, समझदार बच्चे. चलो सर, नाउ let us write down what is the spermatic cord made up of. Can anyone tell me what is the spermatic cord made up of, sir? The artery which is supplying the blood to testis, testicular artery. The vein which is going to drain the blood from testis. बोलो बच्चों, vein का नाम क्या होगा? What is the name of the vein? Any idea? The vein which is going to drain the blood from your testis will be pampiniform plexus of vein. What is the meaning of plexus? Plexus means network. We have already learned in upper limb topic, brachial plexus. Plexus means what's a network. Pampiniform plexus of vein. And then along with that there will be a nerve, and that nerve will be the genital branch of genitofemoral nerve. Genital branch of genitofemoral nerve. Then there'll be a duct, and that duct is vasa deferens or ductus deferens. And all this will be surrounded by 3 fascia. There will be one external spermatic fascia, and in the middle there'll be a cremasteric fascia, and then you'll be having the internal spermatic fascia. So external spermatic fascia, and then there'll be cremasteric fascia, and then you'll be having the internal spermatic fascia. So artery, vein, nerve, and the duct, and all of them will be surrounded by a fascia, and that fascia will be actually the 3 of them. So external spermatic, internal spermatic fascia, and the middle one will be the cremasteric fascia. Okay, बच्चों, are you all done, my dear friends? That is about the spermatic cord topic. Like one more topic has been completed here. एक और topic साथ में हो गया. So I think from here you're understanding that it is like one of the most important topics in inguinal canal. And inguinal canal के साथ-साथ में हमने ना बहुत सारे topics यहाँ पर complete कर लिए. The location of that, the length of that, the boundaries, anterior, posterior, superior, inferior, and the content. And along with the content, we're also done with the spermatic cords. Amish Sheikh is asking, Amish Sheikh, Rohit Kumar, retraction reflex by genital. Yes. I will teach you that later on, but not now. Genital branch of genitofemoral nerve, it's actually involved in that cremasteric reflex. कहते हैं उसको. Cremasteric reflex. Very good, Rohit. Okay. So this is the inguinal canal in males, and in male there'll be which one's the spermatic cord. And spermatic cord, if you see here in detail, is artery, testicular artery. There'll be a network of vein, pampiniform plexus of vein. There'll be a nerve here, genital branch of genitofemoral nerve, and then there is a duct here. The duct is vasa deferens. All that will be surrounded by fascia. Perfectly done, sir. Perfectly done, sir. Is it okay? चलिए बढ़िया. Any doubt here? Let me know. Any doubt here? Please let me know. Then we'll go ahead. So from last 1 hour, whatever we have studied, guys, it's like extremely important thing, and everything is very well planned and very systematically arranged there. So you have to learn about the anterior abdominal wall, all the 8 layers of the anterior abdominal wall, then the inguinal canal, then everything related to that one, and even a small topic, spermatic cord topic has been done, sir. अब ये पढ़ना क्यों important है? Why should we study all these things here? Yes, why? Because please write down the heading there as applied aspect here, sir. Why should you learn this topic so much crystal clearly here? The clinical correlation, applied aspect here is hernia. Which hernia? Inguinal hernia, guys. Inguinal hernia will be actually of 2 types, sir. One will be the indirect inguinal hernia. Another one will be the direct inguinal hernia. One is indirect inguinal hernia, another one is the direct inguinal hernia. Indirect inguinal hernia is the one which will be occurring via deep inguinal ring. The direct inguinal hernia is the one which will be occurring via the anterior abdominal wall. I'll give you one small diagram here. Everything will become very clear now. Look here, guys. Man lo ke this one is the costal margin here. Xiphoid process, the costal margin here. This one is your abdomen here. Inguinal ligament, blah blah. There will be a deep inguinal ring here, oval shape, and then here there will be a triangle shape, superficial inguinal ring. I mean to say inguinal canal. In the center there is a linea alba. मान लो ऐसे. Now, if the herniation is occurring, hernia यहाँ से हो रहा है sir. Are you getting a point here? If that herniation is occurring from the deep inguinal ring and is going to come out via the superficial inguinal ring, that herniation is said to be the indirect inguinal hernia, sir. If the herniation is occurring via the deep inguinal ring and is going to come out via the superficial inguinal ring, that is said to be the indirect inguinal hernia. Indirect inguinal hernia. Very simple. ये तो बड़ा आसान है sir. It's very easy. Done. Now what about the direct, sir? Direct is occurring via anterior abdominal wall. But यार बड़ा खतरनाक है. This complete is anterior abdominal wall only. This complete is anterior abdominal wall. Where exactly? Exactly कहाँ से होता है? In the anterior abdominal wall, here you'll be having a triangle, and the herniation will actually occur from this triangle, guys. And that triangle is known as your Hasselbalch's triangle. Yes, very good, Masu. Yes, that herniation is occurring from the Hasselbalch's triangle. तो उसको हम कहते हैं direct inguinal hernia, guys. Wow. So indirect inguinal hernia will be the one which will be occurring via deep inguinal ring, and direct will occur via the anterior abdominal wall. To be more specific, direct will occur via Hasselbalch's triangle. And I am teaching you this entire topic for that one only. What? Hasselbalch's triangle. Why? Because in your exam they'll be asking you what are the boundaries of Hasselbalch's triangle. Hasselbalch's triangle के ना आपको ना boundaries पूछा जाएगा. You have to learn the boundaries. Is it okay? चलिए. First, for 2 minutes, you people don't write anything. So just look at the screen here. I will show you the boundaries here. Then later on, I'll make you draw the diagram. Hasselbalch's triangle, it is also known as what? It is also known as inguinal triangle. First, you try to understand this diagram. So, ये diagram हम लोग कैसे देख रहे हैं? In this diagram, exactly in the center. In this diagram, exactly in the center here, guys, this is linea alba there. That's linea alba. Anatomy subject is being respected. It's just because of you, sir. Thank you, Hari bhai. Big words. I'm a small guy. So this one is actually the linea alba here, and in the middle this will be the pubic symphysis, guys. और यहाँ पर ये muscle, what is this muscle here, sir? Rectus abdominis muscle. And similarly on the other side also you'll be having the rectus abdominis muscle. Okay, that means yes, I'm able to understand that diagram is only like one half. आधा वाला diagram है, sir. I'll be having rectus abdominis on one side, rectus abdominis on the other side. I'm just seeing the one half, guys. Okay, look here. Guys, can you please tell me what is this ligament here? ये ligament कौन सा वाला है, sir? Come on, be quick. There's your inguinal ligament, and that inguinal ligament is actually going to form the base. Inguinal ligament is forming what, sir? The base. And after that, medially what do you have? Medially you'll be having the rectus abdominis muscle. And after that, laterally what do you have here? Laterally you'll be having the inferior epigastric vessels. Inferior epigastric vessels, guys. Wow. In between these three, you're able to find one triangle, and that triangle is said to be the Hasselbalch's triangle. And that Hasselbalch's triangle, from there hernia will occur, and of course that is your direct inguinal hernia, sir. Directly occurring to the anterior abdominal wall. Direct inguinal hernia. So you have to know all those boundaries. Lekin, yes, we are not at all going to learn in this manner. We are going to learn in our style, in my style. हम क्या करेंगे, sir? Let's draw this diagram, sir. चलो, did you write down this name? पहले heading लिखो सर अपने books में. Yes, let's learn in Dr. Azam's style. Okay, बच्चों, heading लिखा आपने? चलिए, start drawing the diagram along with me. Now imagine here this one to be the pubic tubercle and symphysis here, and this one here will be the pubic tubercle, and this one is the symphysis. Pubic symphysis in the middle. Exactly in the middle there will be a shallow depression here, and this depression is said to be the linea alba. There is a linea alba here, and then on either side you'll be having a rectus abdominis muscle here, and then there will be rectus abdominis muscle here, guys. Now imagine here this one to be the anterior superior iliac spine, and this here to be the pubic tubercle, guys. Between these two there will be a ligament, and that ligament will be your inguinal ligament. And finally, my dear friends, here you'll be having the inferior epigastric artery. Along with that, you'll be having the inferior epigastric vein. So between these three, whatever triangle you're able to see here, that is your Hasselbalch's triangle. Hasselbalch's triangle, guys. Write on the notes now along with me. Inguinal ligament is going to form what's the base of Hasselbalch's triangle. Rectus abdominis muscle, that is going to form which boundary? The medial boundary. And then finally this one here, that is your inferior epigastric vessels. Inferior epigastric vessels, they are actually the one which are going to form the lateral boundaries. Base will be formed with the inguinal ligament, medially rectus abdominis muscle, and laterally you'll be having the inferior epigastric vessels. Wow. If you draw a diagram like this, I bet you, I challenge you, you will never ever forget in your lifetime, sir. Forget about learning in a paragraph and paragraph. वो paragraph पढ़ना ना भूल जाओ सर आज से, ठीक है? So this will be the Hasselbalch's triangle exactly. क्या बात है? समझ आ रहा है बच्चों? Are you understanding, my dear friends? Good. Okay, so we are done with the base, we are done with the middle wall and the lateral wall. Everything done. We can do the Hasselbalch's triangle. Acha, please don't forget that after learning Hasselbalch's triangle, don't forget which type of hernia will occur from here. Is it like indirect or direct? Is it indirect or direct? There should be no confusion. And to avoid that confusion only, I have given you this diagram, sir. Here diagram. I think that will be never making you anything confused here, sir. If the hernia is occurring via the deep inguinal ring, that is nothing but the indirect one. And if it is directly through the anterior abdominal wall, piercing through the anterior abdominal wall, it's direct. And that is exactly through Hasselbalch's triangle. Along with that, this is also done. और क्या चाहिए जिंदगी में, है ना? मजा आ रहा है पढ़ने में? Are you understanding? चलिए सर, बढ़िया. चलिए सर, बढ़िया सर। ओके, चलिए बढ़िया 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 बढ़िया। आई एम रियली हैप्पी विद दिस वन हियर। अब हम एक काम करेंगे सर, आफ्टर कंप्लीटिंग दिस एंटायर सीक्वेंस यू आर गोइंग टू लर्न द एंटायर थिंग इन द सेम सीक्वेंस गाइस। सो anterior abdominal wall, all the 8 layers of the anterior abdominal wall, and after that inguinal canal, the boundaries of that content, and in the content learn very well about the spermatic cord, and after that applied aspect in inguinal hernia, direct, indirect, and the direct one you have to learn about the Hasselback's triangle. So everything is done in a very sequential manner, nothing randomly here and there guys. चलिए, now after completing all these things let us learn about the next topic, that is rectus sheath now sir. और फिर से दोबारा आपको भी करना पड़ेगा, just for 2 minutes sit back relax. I'll first of all tell you the entire concept, and then after that we are going to draw the diagram. So literally we are going to draw the diagram. Guys, right from the beginning of the class, I'm telling you there are 3 muscles coming from the lateral side. What are the 3 muscles which are coming from the lateral side, sir? External oblique, internal oblique, and transversus abdominis. Not only the muscles, even their aponeurosis will also do this. Okay. External oblique, internal oblique, and transversus abdominis. These 3 muscles are coming there, and their aponeurosis is. Apart from that, 3 muscles coming from the lateral side. In the middle, you'll be having one muscle here. That is rectus abdominis. Rectus abdominis. And then there will be a small muscle below there. If you're able to appreciate, that small muscle is nothing but your pyramidalis muscle. Are you understanding, my dear friend? So there'll be one muscle in the middle here, that is your rectus abdominis muscle, and then there'll be a small muscle below here, and that muscle will be your pyramidalis muscle. That is pyramidalis muscle, guys. Okay. And this rectus abdominis muscle here will be actually having the tendinous intersections, guys. Rectus abdominis muscle will have tendinous intersections here, and because of the tendinous intersection, rectus abdominis muscle will be divided into those packs, your 6 packs or your abs there, guys. 6 packs or the abs. So this is your favorite muscle which will be always trying to develop, लेकिन वो जिंदगी में हो नहीं पाता है, ठीक है ना? तो तुम्हारे पास में भी 6 पैक है, मेरे पास में भी 6 पैक है, बड़ा सेफली अंदर रखा हुआ है सर, ओके ना? ऊपर से हमारा ना वो कैंपर्स फेशिया, फैटी लेयर. Now muscle is worried, sir 6 pack कह रहे हैं, यहाँ पर 3 ही है ना? So remaining 3 will be present on the other side. On the other side we have removed that muscle, guys. So rectus abdominis on one side and rectus abdominis on the other side. 6 pack. Are you comfortable with this one here? Hello. And now we need to learn about what? We need to learn about rectus sheath. And in rectus sheath we have to learn what? Boundaries. And to learn the boundaries, there is a problem. What's the problem? The problem here is that if I just look at the rectus sheath from the front, अगर मैं just आगे से rectus sheath देखूंगा ना, I'm not able to see the boundaries clearly. Why? If I see it from the front here, I'm able to see only the external oblique wala here, only the external oblique. I'm not able to see the internal oblique and transversus abdominis here. I'm only able to see the external oblique here. ठीक है बच्चों, are you done? So that is the reason why, हाँ, very good Ritesh. Ritesh बहुत intelligent हो गया अभी. Yes, we need to take a transverse section. Once you take a transverse section, the diagram will look like this. क्या बात है? Rectus abdominis muscle. In the center, linea alba. And now you can appreciate very clearly here, external oblique, internal oblique, and transversus abdominis. The 3 muscles and their aponeurosis are coming here, sir. And those aponeurosis are going to form what only? They are going to form a sheath, and that sheath is known as what? Rectus sheath. Okay, sir, rectus sheath. But do we have to learn about this entire diagram? No. We just have to learn about this one, rectus sheath. So चलिए इसको करते हैं zoom. And once you zoom that, the diagram will be something like this. अच्छा, कुछ याद आ रहा है? Have you seen this diagram in your MBBS days? Yes. चलिए सर, अब हम ड्रॉ करते हैं. Please write down the heading there as rectus sheath. I am done with the entire concept, explaining part done. Now start writing the notes. Rectus sheath, it is formed by aponeurosis of external oblique, internal oblique, transversus abdominis. Rectus sheath, it is formed by aponeurosis of external oblique, internal oblique, and then transversus abdominis. Okay. And after that, you need to learn about the arcuate line. Arcuate lines. अब ये क्या बला है? What is this arcuate line? Arcuate line is between the umbilicus and pubic symphysis. Arcuate line is between the umbilicus and pubic symphysis. Now let us go again to the very first diagram and let me show you there, guys, and what is the importance of this one. Everyone here. Here this is your umbilicus, and this here will be the pubic symphysis. And exactly in the middle of this, you'll be able to find one imaginary line here, and that line is said to be arcuate line. Okay, sir, understood. We got the location of the arcuate line. But sir, what is the importance of arcuate line here? What is the importance of this one? Yes. Above the arcuate line, the arrangement of rectus sheath will be different. And below the arcuate line, the arrangement of the rectus sheath will be quite different, guys. Oh my god. So that means arcuate line is the one which is differentiating. Above the arcuate line, rectus sheath arrangement, the boundaries will be different, and below the arcuate line will be different. That's the reason why I have to take one transverse section above arcuate line, and I have to take like one transverse section below the arcuate line to learn the boundaries. Our headache increase now. That's the reason why in your textbook you'll be having like these 2 diagrams here. ये 2 diagrams होते हैं आपके textbook में, one above the arcuate line, another one below the arcuate lines. Are you understanding it crystal clearly, guys? So चलिए, if you people are understanding properly here, please write on the heading there as boundaries. Now let us see what are the boundaries of rectus sheath. Now what are the boundaries of rectus sheath, guys? ठीक है? What you did not get, the happy brain. Oh, the happy brain घूम चुका है अभी. How? SYM क्या होता है भाई? How? See, we are actually going to learn about the boundaries of rectus sheath, but the problem here is that we cannot learn the boundaries of rectus sheath only at once. Why? Because rectus sheath, I mean to say that 3 aponeurosis arrangement will be different above the arcuate line and below the arcuate line. So we need to once learn above the arcuate line boundaries, and we have to learn once the arcuate below the arcuate line the boundaries of that rotation. एक बार arcuate line के ऊपर पढ़ना होगा, एक बार arcuate line के नीचे पढ़ना होगा, क्योंकि ऊपर और नीचे अलग-अलग अरेंजमेंट है, अरेंजमेंट अलग-अलग है. ठीक है, तो चलिए स्टार्ट करते हैं. So basically what is rectus sheath here? It is formed by the aponeurosis of external oblique, internal oblique, and transversus abdominis. Now let us learn the boundaries above and below. So write on the setting there as above arcuate line. First of all, make the platform ready. This is rectus abdominis muscle, and there will be one more rectus abdominis muscle on the other side, and in the middle you'll be having linea alba. Then from the lateral side there will be three muscles, guys. One will be your external oblique, internal oblique. Another one will be transversus abdominis. Now above the arcuate line, what is going to happen? Arcuate line के ऊपर क्या होगा? External oblique aponeurosis is actually going from here, guys. Can you please tell me? It is like anterior, posterior, or superior, or inferior? External oblique aponeurosis is going from where? Is it like anterior, posterior, superior, or inferior? Very good. How can you tell it is anterior? मुझे तो यार ये ऊपर लग रहा है. It is superior. Is it not superior? Come on. Is it like superior or anterior? Something. It is superior or it is anterior. Come on. Some answers are superior, some answers are anterior. Very good. Remember, external oblique aponeurosis is actually going where only? Anterior. Why? Because it is not like, we are saying from the front, it is the transverse section. Transversus abdominis aponeurosis is going from here, sir. Is it anterior or posterior? It is posterior. Internal oblique aponeurosis will be dividing into two lamina. One lamina will be going from here anteriorly, another lamina is going from the posteriorly, guys. Are you understanding the orientation now? Therefore, that rectus sheath, जो rectus sheath form होता है ना, what is forming the anterior wall of the rectus sheath? Anterior wall is formed by external oblique, internal oblique. What is forming the posterior wall of the rectus sheath? Posterior wall will be formed by, yes, transversus abdominis, internal oblique. Transversus abdominis, internal oblique. Fine, and this is the arrangement above the arcuate line. If some people are like, not able to trust on me whether the sir is teaching correctly or not, look at this diagram, textbook diagram. Rectus abdominis muscle and rectus abdominis muscle. In the center, what do you have? Linea alba, and here this external oblique and this internal oblique, and then transversus abdominis. And then what is going to happen here? External oblique aponeurosis anteriorly, transversus abdominis posteriorly. Internal oblique will be actually dividing into two lamina. You can clearly see one anterior, one posterior. Wow, that is how is the arrangement present above the arcuate line. Yeah, arcuate line के ऊपर. Yes, Rohit Kumar is asking, then what about the conjoint tendon? Yeah, Rohit Kumar, तुमने मुझे ये बताओ, where did we learn about the conjoint tendon? Conjoint tendon कहाँ पर था? Inguinal canal. And where do we have the inguinal canal? Inguinal canal is just present here. Inguinal canal यहाँ पर है आपका. We have learned posterior to the inguinal canal there was conjoint tendon. है ना? That is your inguinal canal boundaries. Inguinal canal यहाँ पर है और मैं आपको यहाँ पर बता रहा हूँ. I'm telling you here, above the arcuate line. Above the arcuate line. Okay. Now welcome just below the arcuate line here, guys. Okay ना? वो बहुत नीचे होता है. Don't worry about that. Conjoint tendon and all. That is present very below. Now welcome here. I'll show you what is happening below the arcuate line. Below arcuate line, and just make the platform ready. Rectus abdominis on both the sides. In the middle, you'll be having what is linea alba, and then the three muscles coming from the lateral side there: external oblique, internal oblique, and transversus abdominis. And below the arcuate line, what is going to happen? External oblique aponeurosis is going anteriorly. Internal oblique aponeurosis is also going anteriorly here, and not only that, even the transversus abdominis aponeurosis is also going anteriorly. All the three of them are going in the front. Therefore, what is forming the anterior wall? The anterior wall will be formed by the external oblique, internal oblique, transversus abdominis, guys. All the three of them. And then what about the posterior wall here? Nothing, deficient. Understanding, guys? So anterior wall of the rectus sheath, crystal clear, and then the posterior wall here, you don't have below the arcuate line. And let me just show you the picture here. Yes, you can clearly see here, my dear friends. In this picture or in this image, external oblique, internal oblique, and transversus abdominis, all the three muscles and their aponeurosis are going in front of, anterior to the rectus abdominis, nothing behind. So that is about the boundaries of rectus sheath. That is about the boundaries of rectus sheath. Now, once you're done with the boundaries of rectus sheath, the next thing will be what are the contents of rectus sheath. And the good news here, I don't even have to teach you the contents. Inside the rectus sheath, you'll be having two muscles, and my students knows that very well. Come on, tell me. Number one muscle will be rectus abdominis muscle, and number two, you'll be having one small muscle below, that is pyramidalis muscle. Then you'll be having like two vessels here. Which two vessels do you have inside the rectus sheath, sir? Number one, I told you already in the thorax topic, sir. That is superior epigastric artery and vein. Superior epigastric artery and vein, guys. And I already told you about this in the thorax topic. If you people are able to recall and tell me, my dear friend, that is nothing but the branch of which one only? Superior epigastric artery is a branch of which one? It's a branch of your internal thoracic. And along with that, you also have got the inferior epigastric artery and vein. Inferior epigastric artery and vein. Okay? And after that, two muscles and two vessels. Now, what about the nerves here? Nerves, remember, my dear friends, there'll be lower 6 thoracic nerves. And that lower 6 thoracic nerve will be nothing from T7 to T12, guys. So right from T7 to T12, the lower 6 pairs of thoracic nerves will be coming into the rectus sheath here. So you're done with the muscles, you're done with the artery and vein vessels, and then you're done with the nerve supply here. That's about the contents and boundaries of rectus sheath. Crystal clear. Happy brain, I think you actually got lost somewhere in the middle. जो हमने ये draw किया है ना, whatever this blue colored one that we have drawn here, that is itself is nothing but aponeurosis. आप बीच में कहीं पर गए थे क्या? लाइक इन द मिडल ऑफ द क्लास डिड यू गो समवेयर? आई टोल्ड यू वेरी क्लियरली इन दिस डायग्राम, मैंने आपको पूरा सीक्वेंशियली बताया है. फर्स्ट ऑफ ऑल वी आर सीइंग दिस डायग्राम फ्रॉम द फ्रंट, एंड आफ्टर सीइंग दिस डायग्राम फ्रॉम द फ्रंट विल नॉट बी एबल टू सी द थ्री अपॉन यूनिवर्सेस, दे आर वन इनसाइड द अदर. ठीक है ना? दे आर वन इनसाइड द अदर, सो बिकॉज दे आर लाइक वन इनसाइड द अदर वी कैन नॉट सी देम फ्रॉम द फ्रंट, हम आगे से नहीं देख पाएंगे. आर यू अंडरस्टैंडिंग? हैप्पी ब्रेन, अरे अपना नाम लिख दो यार, ये बड़ा फर्स्ट ऑफ ऑल सब्जेक्ट इटसेल्फ इज डिफिकल्ट, मैं बार-बार नहीं कह सकता हैप्पी ब्रेन हैप्पी ब्रेन. हां, तो व्हेन यू आर सीइंग फ्रॉम द फ्रंट, जब आगे से देख रहे हो, व्हेन यू आर सीइंग फ्रॉम द फ्रंट, एक्सटर्नल ऑब्लिक, inside that internal oblique, inside that will be having transverse abdominis. Are you able to see from the front? क्या आप सामने से देख पाओगे? No, I am not able to see all the three of them. That is why I am taking a transverse section. When you take a transverse section like this here, the diagram is something like this. Diagram इस तरह हो जाएगा. I am taking a section और यहाँ पर crystal clear है. External oblique, internal oblique and transverse abdominis, they are coming from sides, lateral side, and their aponeurosis is going to enclose this one. उसी को तो हम rectus sheath कहते हैं. That itself is rectus sheath. And we need to learn the boundaries of rectus sheath. Panga problem. That boundary is different above the arcuate line, below the arcuate line. That is why we are taking one section above, one transverse section below. ये दोनों diagram है. आर्कुएट लाइन के ऊपर और आर्कुएट लाइन के नीचे, एंड देयरफॉर दैट इज व्हाट वी हैव ड्रॉन हियर सर, परफेक्टली करेक्ट गाइस, है ना? डॉक्टर डोनाल्ड इज राइटिंग देयर, धागे की तरह खोल दिया. हां भाई ऐसे होगा. स्टैंडर्ड एब्डोमिनल वॉल क्रिस्टल क्लियर गाइस. So in the beginning of the class, what I tell you? In the beginning of the class, I told you the planning. What is the planning? How to learn the abdomen topic? First, abdominal wall, anterior abdominal wall, and posterior abdominal wall. Then we are going to enter inside the abdomen to learn about all the organs. है ना बच्चों? And now in this entire session, till now, what we have learned is we have learned only the anterior abdominal wall. हमने सिर्फ anterior abdominal wall पढ़ा है. It looks like only anterior abdominal wall. There are so many concepts there, and there are so many MCQs there, guys. So you should know the regions of the abdomen. Abdomen is divided into how many regions? 9 regions. You should know the planes in the abdomen, the horizontal and the vertical planes. Then you have to know all the 8 layers in the anterior abdominal wall. Done perfectly. And then inguinal canal. In inguinal canal, you have to learn the boundaries and content. In content, come on, spermatic cord in males. Learn the spermatic cord topic. Then after that, the applet aspect, inguinal hernia, indirect and direct. Direct inguinal hernia, then learn about the Hasselbeck's triangle. So it's all like a kahani, sir, like a story. After you're completing the inguinal canal, then learn about the rectus sheath. Rectus sheath, boundaries of that sheath, and then you have to learn the contents of the sheath, guys. Boundaries and the content. ठीक है बच्चों? And by this, we complete everything about the anterior abdominal wall. And now, welcome to the posterior abdominal walls. I hope you are completely understanding my planning. Dr. Paul is trying to ask something. What is Paul asking? Sir, these boundaries are covered by aponeurosis, right? Dr. Paul, it's not like boundaries are covered by aponeurosis, यार. वो खुद aponeurosis है. They are made of aponeurosis. Yeah, they themselves are aponeurosis actually. External oblique muscle, and this is external oblique aponeurosis. Transverse abdominis muscle and transverse abdominis aponeurosis. Is it clear? What about the other people? Am I like confusing you? Hello everyone. Is it like confusion, something like that, or is it like clear? Chalo. Thank you. Welcome. Thank you, sir. चलिए. So we are done with the boundaries, and then we are done with the contents of rectus sheath. Contents भी हो गया sir. अब बढ़ते हैं हम आगे. Let us go ahead. Anterior abdominal wall done. Welcome to the posterior abdominal walls. Happy brain हो गया. चलिए सर. Now welcome to the posterior abdominal wall. Posterior abdominal wall is like easy topic sir. ये तो मतलब 2 मिनट में हो जाएगा. It will be done in 2 minutes. And after that, we'll finish off the abdominal wall, and then I think at 6 o'clock we can take a break for half an hour, and then from 6:30 onwards we can continue with the inside the abdomen, sir. Understanding the entire planning? So this one session is all about the abdominal wall, anterior and posterior, and the next session will be all about your abdominal viscera. That will complete your entire abdomen topic today, sir. Okay. So chaliye, welcome here. What is this posterior wall of the abdomen made up of? It is made up of totally 4 muscles. How come? Look at this diagram. Now in this diagram, are you able to see this muscle here? Psoas major. Are you able to see the small muscle here? Psoas minor. Psoas major, psoas minor. Then there will be a rectangle shaped muscle here. There will be a rectangle shaped muscle here. In anatomy, whenever you have a rectangle shape or quadrangular shape, we can call it as quadratus, and it is in the lumbar region, lumborum. Quadratus lumborum muscle. And then this is nothing but your hip bone, or hip bone to sabko pata hai. Upper expanded part will be ilium, and the part meeting in the front will be your pubis, and the part below here, on which you and me are sitting right now, this will be your ischium, sir. So there will be ilium, ischium, and pubis. Ilium, ischium, and pubis. And from this upper expanded part ilium, there is one beautiful muscle coming here, sir. And this beautiful muscle which is coming from here will be your iliacus muscle. What is that one? Iliacus muscle. And all these 4 muscles together, they are going to form your entire posterior abdominal wall, sir. So entire posterior abdominal wall is made up of psoas major, psoas minor, quadratus lumborum, and the iliacus muscle. The posterior abdominal wall is made up of 4 muscles. Number 1, psoas major. Number 2, psoas minor. Number 3, quadratus lumborum. And number 4 will be your iliacus muscle. Psoas major, psoas minor, and the quadratus lumborum, and the iliacus muscle, guys. These are the 4 muscles which are going to form your posterior abdominal wall. Class. बस इतना ही पढ़ना है, nothing else here. Nothing else to be learned here. As I told you, hardly like 2 minutes. And if you people remember, yes, recently your last MCA exam question, this is actually the greater trochanter of femur, and this will be the lesser trochanter, guys. And what was asked recently in the MCA exam, lesser trochanter was marked in the radiological image. In that X-ray picture, lesser trochanter was marked, and what is the muscle getting attached to lesser trochanter? What is the muscle getting attached to the lesser trochanter? And you can clearly see that it is iliacus muscle, and along with the iliacus muscle, you can clearly see that is your psoas major muscle. And those two together are coming here, and they are getting inserted onto the lesser trochanter. Are you getting me? Those two muscles, iliacus and the psoas major, are getting inserted to the lesser trochanter. So, कुल मिलाकर दोनों को together, both of them, they are also called as iliopsoas. Some of the authors will write down that as iliopsoas. So there'll be iliacus and along with the psoas major, iliopsoas muscle. ठीक है, तो ये क्वेश्चन आपके एग्जाम में पूछा गया था. So try to understand here. I hope you people have studied lower limb along with me. Hello, my dear friends. Try to understand here. You people have already studied the lower limb topic along with me. Iliacus and the psoas major, they are forming the posterior abdominal wall. Is there a part of the posterior abdominal wall? Yes, sir. Not only that, here in the lower limb topic, I taught you about the femoral triangle here. मैंने आपको femoral triangle in detail पढ़ाया है, sir. I taught you the femoral triangle in detail. कुछ याद आ रहा है? And not only that, in the recent image-based session, I have given that what do you say, that workbook also, and that workbook we have even marked also that in the cadaveric image. So the femoral triangle, the floor of the femoral triangle, the floor, very good, Namira Khatun. The floor of femoral triangle will be made up of like how many muscles, sir? 4 muscles, and those 4 muscles, out of that 4 muscles, the 2 muscles will be again which one only? The iliacus and the psoas major, and then there will be pectineus and adductor longus. So they are not only forming the posterior abdominal wall. What I'm trying to tell you is that they are also forming the floor of femoral triangle also. So I'm just trying to connect your abdomen topic with the lower limb topic. हमने ये lower limb में already कहीं ना कहीं पढ़ा है, sir. In the lower limb topic, we also have studied about those 2 muscles. Iliacus and the psoas major are going to form the floor of the femoral triangle, and they are inserting on the lesser trochanter, guys. Are you getting the connection now? Hello, my dear friend. Are you all understanding the connection now, sir? Perfect. That completes about the anterior abdominal wall, and that completes the posterior abdominal wall, sir. Anterior and posterior abdominal wall is done and done and done. And after the break, we'll continue with the remaining, visceral organs inside this one, sir. कोई दिक्कत? Any दिक्कत till here? मेरा खातिर चलेंगे सर, आप यूरो जनरल सिस्टम बियोलॉजी पढ़ाओगे? हाँ, क्यों नहीं पढ़ाएंगे, बिल्कुल पढ़ाएंगे. We'll try. I'll teach you in the coming sessions. I think today, tomorrow, our sessions are already scheduled. So I'll surely teach you. Don't worry. Namira Khatun. Ritesh Kumar, no. Okay. Sushant is asking, sir, biochemistry. Biochemistry will be shortly done, guys. Okay. I think Unacademy, the team will be returning back in a couple of days. Actually, पूरे सब लोग ना leave पर है. Like most of the people for this new year and all those things. So once they're back by tomorrow or day after tomorrow, we'll start back with the scheduling part and everything. तो जनवरी के शेड्यूल में भी हम लोग ना biochemistry start कर देंगे. Ritesh Kumar is asking, what? Ritesh Kumar, क्या चाहिए आपको? बोलो रितेश कुमार, क्या चाहिए? अच्छा, मैं नहीं गया घूमने. अरे भाई, मैं कहाँ जाऊँगा घूमने? मैं एक्चुअली घूम के आया था ना. I went to Bangalore. I had like 3 hectic days of meetings and all those things. मैं बहुत थक गया था. तो I took advantage of that 1 or 2 days and I was sleeping. Full 2 I was sleeping actually. तो I did not go anywhere. चलो सर, हो गया बच्चों. Sir, do you remember 2017 in Kyiv? Oh my goodness. Are you from there? Which university in Kyiv? Dr. Paul. अरे बाप रे. मैं वहाँ पर एक्चुअली डेमो कुछ देने के लिए मैं आया था कीव में. दैट वाज एक्चुअली, हाँ, डेमो ओरिएंटेशन देने के लिए मैं आया था वहाँ पर. एंड दैट एक्चुअली आई कैन नॉट फॉरगेट अबाउट दैट वन. मैं एक्चुअली ट्रांजिशन में डेमो देने के लिए आया था आपको. माय फ्लाइट वाज इन ट्रांजिशन. ट्रांजिट कहते हैं ना, ट्रांजिशन बोल रहा हूँ मैं ट्रांजिट में आया था वहाँ पर. हाँ, आई जस्ट लैंडेड इन यूक्रेन कीव देयर. एंड आफ्टर लैंडिंग देयर किसी ने मुझे पिकअप किया था. ऑन द वे मुझे बहुत भूख लग रहा था, तो मैकडी का बर्गर लिया, सीधा क्लास, 2 घंटे का ओरिएंटेशन, बैक टू एयरपोर्ट, देन अगेन नेक्स्ट फ्लाइट. इट वाज इन ट्रांजिट. आई कैन नॉट फॉरगेट दैट वन. वाओ, सेंड मी दोस पिक्चर्स यार, भेजो मुझे, ठीक है? हाँ. सर, चाइना में आए हो आप कभी? अरे बाप रे. सर, अपना स्टेटमेंट चेंज कर लो. इन फॉरेन कंट्रीज चाइना इज लाइक सेकंड होम. चाइना एंड यूक्रेन इज लाइक सेकंड होम. चाइना में आए हो आप कभी नहीं? बीजिंग, शंघाई, चोंगचेंग, सिचुआन, चेंगडू, आई डोंट इवन रिमेंबर नेम्स, जिंजो, डालियन, जिलिन, और कहाँ गया मैं बहुत सारी जगह पर गया. आई एम टेलिंग यू, आई एम नॉट एबल टू. गोंगशी, गोंगजाओ, तो मुझे याद भी नहीं आ रहा सारे नेम्स. चलो सर. Ukraine, I came many places. I was in Kyiv, I was in Odessa and Ivano and Uzhgorod, Kirograd. I went to many places there in Ukraine also. So, चलो यार, I think other people are getting angry now. इसको खत्म करते हैं. Anterior abdominal wall हो गया, posterior abdominal wall हो गया. I hope you're enjoying my class here. So I'll again meet you after half an hour. आधे घंटे के बाद में अच्छे से मस्त में ब्रेक ले लो. I'll meet you after half an hour. चलो सर, thank you.